One of the very important issues that will affect this election is healthcare and the candidate views on how to fix our healthcare system. Before I go on to the individual plans of both of the major candidates, let's take a look at the facts of our healthcare system today. Fact number 1. There are over 40 million people in this country that are uninsured. Fact number 2. Those uninsured people will tend to allow their health problems to get to a point where they need to go to the emergency room to get care. Fact number 3. Hospitals cannot turn away people in an emergency. Fact number 4. It is generally cheaper to treat a condition earlier than later, making preventive care much cheaper than emergency care. Fact number 5. Hospitals do not want to take a loss and will pass on the costs of unpaid emergency care visits to those who can afford to pay, making the cost of healthcare rise. Now, with that being said, it is obvious that we are currently paying for the health care of those who are uninsured because the costs associated with emergency care are passed on to us in the form of higher insurance premiums. So let's see how the candidates deal with this issue of the uninsured. Barack Obama has a plan for those 40+ million uninsured people. He will create a plan that is similar to what the congressmen have and allow those uninsured people to opt in. Yes, of course, this will cost tax dollars, but we as taxpayers should see a net increase in income, and here's why. The extra money that we pay in tax dollars to cover this plan that offers preventive care will be less than the money that we save in insurance premiums because we will no longer be paying for their emergency care. Again, the reason we have reduced insurance premiums is because we no longer have to pay for our share of their emergency care. And since our share of the preventive care is less than our share of the emergency care, we save money. Obama's plan, unlike some others that have suggested full coverage, allows people to purchase or keep private insurance plans if they so desire. So if I like my current plan, which I currently do, I get to keep it. Now, let's take a look at John McCain's plan. First and foremost, if you read his plan, you will notice that he is pushing for high-deductible health savings account plans. HSAs are fine for some people, but not for everyone. Now, John McCain will eliminate the tax incentive that businesses get for providing health care to their employees and would instead give money to individuals, $2,500, or families, $5,000, to get their own coverage. The remainder of any funds after paying for their health care plans would go into a health savings account. So the only real way that a high-deductible HSA plan would work is if the total cost of the insurance plus the total cost of the deductible equal the money that you would get. And that's not going to happen. What is even more flawed with John McCain's plan is that by eliminating the tax benefit, employers may drop insurance coverage. The insurance coverage that employers currently get is typically negotiated for both lower prices and so that no health screenings are required for coverage. Without such negotiation, people would wind up paying much more for their health insurance than the $5,000 that John McCain is proposing for families. In fact, the average health care cost for a family of 4 is over $12,000, according to the National Coalition on Healthcare. And that cost is just the average employer-based health care plan, which again comes at a reduced negotiated group rate. So basically, we will wind up with more uninsured people because I don't know how many of those people, after getting the $5,000, will be able to cover the remaining $7,000 to pay for their health plans. So, now that John McCain's plan has just created more uninsured people, what is his plans for them? His own website states, as president, John McCain will work with governors to develop a best practice model that states can follow, a guaranteed access plan, or GAP, that would reflect the best experience of the states to ensure these patients have access to health coverage. In a nutshell, when it comes to the uninsured, John McCain has no plan, period. The choice is clear, folks. All McCain wants to do is promote health savings accounts for people and has no plan to deal with the uninsured. Barack Obama's plan, on the other hand, is better, it is more complete, and it does deal with the uninsured while bringing down our health insurance rates. If anybody is making a decision on this election based off of health care alone, you would have to admit that Barack Obama's health care plan is better and more complete. And no, conservative Republicans, we all know that you like to say that Barack Obama is promoting socialist health care. It's just not the truth. Again, we get to keep our health care plans if we like them currently, and since we are already paying for the health care for people who abuse the emergency room, because emergency rooms cannot turn away people in an emergency, then we are saving money and being more fiscally responsible by treating these people with preventive care.